Hi researchers, this is Dr. Balhan. I would like to present a brief lecture here about ethics in research. You have read all about this, hopefully, and I am just giving you some supplemental information from the PowerPoint that I have on Canvas. So, unfortunately, psychology's history has some really dark spots in terms of our ethical treatment of our human participants. Plenty of information that you can read here, but as a result of the Nuremberg trials and some of the first iterations of the APA Code of Ethics, and then the Belmont Report, which is what guides our ethical research, we are now at a place where there's much greater consideration given to both human subjects and animal subjects. One feature that is required for all psychological research is an institutional review board's kind of approval of our studies. You can sometimes hear this called the IRB. And for human participants, the IRB is comprised of committee members from the institution, so this would be a university or a hospital, a research agency, and an outside member. And what the Institutional Review Board must do is make sure that you have all of the required elements for a research study, which we're going to see in a bit, as well as they're trying to minimize liability for the institution. So there's kind of a push-pull, but we submit all of our work to an IRB for review prior to collecting any data. That is absolutely an ethical requirement of our field. Ultimately, what an IRB is looking to determine is, do the benefits of this research study outweigh any of the risks? For us in psychology, the most common risks we can have are risks to social injury. So this would be, let's say, if there's a data breach and participants identifying information got out. Or psychological injury. So if you think back to Milgram's experiments where he was having participants believe that they were shocking another individual, we know that his participants experienced extreme stress and anxiety. So there was some serious psychological injury in his study. And so it's not that we can't have any risks, but it's that the benefits of the study really have to outweigh those. So as the risks get large, the benefits themselves also have to be quite large. Typically, the benefits we think of in psychological research is specific benefits to our participants. So for instance, let's say in a therapy trial, the benefit a participant could get is actually receiving medical care or therapeutic care. And then the other benefit that's typical in our studies is really the generation of knowledge. So how much new information are we able to garner from our project? Okay. So when the risks are terribly high and the benefits terribly low, that is probably a case where an IRB would say this isn't going to fly. An example for this, let's say somebody's interested in replicating Milgram's seminal study about obedience using shock. Well, we already know that there is great risk to participants for engaging in that. We already know quite a lot about obedience, so it's not clear what additional knowledge we would receive. That's probably a case where that replication can't be justified ethically. So risks were too great for the benefits. Ultimately, we're striving for a situation here where the risks are minimized and the benefits are maximized. Now, part of minimizing those risks comes through these requirements that we as psychology researchers all must include in our studies. Okay? The first one being informed consent. So this comes from the idea that our participants have to know what they're signing up for, and they have to agree, and they have to be able to revoke their informed consent, or they revoke their consent at any time. As you learn about the Tuskegee study, which there's a link in Canvas for you to check out that timeline and learn more, this is one of the big features that was violated. The men who quote unquote agreed to participate really did not have an opportunity to agree with a lot of information and to make a truly informed decision about their participation. So usually what informed consent looks like is a form, which I also have a form on Canvas for you, where we outline our study. We say what the purpose is, we say exactly what participants will experience, what they're expected to do, how long we think it'll last. We say what kinds of risks we think are possible. We say what kind of benefits there's going to be, and we of course say that participants can choose to withdraw at any time. To truly make your own informed consent, you have to be an adult and deemed capable, I guess, of making your own even medical choices. So for folks like kids who are younger, or for folks who have some diminished intellectual ability, then we're looking for assent. So it's not that we can't use them as research participants, but we need them to agree. So that's the assent. And then the informed consent will come from a guardian or a caregiver. Now, you might be thinking that a lot of psychology research is a bit tricky, where we deceive our participants. And that's true, especially in social psychology. And we can do that ethically, but we can't give away the whole point in our informed consent, right? Then we wouldn't actually be able to employ deception. So typically with deception studies, our informed consent will say there might be deception. And at the end of the study, you'll have the full view of the purpose and exactly what was going on. So we give a slight preview, but we don't give away the whole secret, so we can actually run the study. Okay. Our deception studies will have a little bit more scrutiny, so we definitely need to be able to make a justification that there's a lot of value to deceiving our human participants. We have to show that we can't get at the effect in any other way. And then typically we cannot deceive with great risks. And so we might look at these as the physical risks or discomfort or really great psychological risks. Okay. Another required feature after informed consent is debriefing. So informed consent begins right at the start of our study, and debriefing is what happens at the end. So at the end of our study, we tell our participants all about what this study was. So we tell them our hypotheses, we tell them the purpose of the study. We give them an opportunity to ask us a bunch of questions, even revoke their participation right at the end. Often we'll provide some resources or services for follow-up, and this might be part of that second bullet point that I have there with desensitizing. So that's where we would reduce any stress or other negative feelings our participants might have based on the study. So oftentimes if college students are our participants, we will provide information about counseling services on campus. De-hoaxing, this is related to deception again. So this is revealing the true purpose of the experiment. And I've mentioned several times, but it bears repeating, that all of our participants have to agree willingly. They have to have a clear option to say no without any penalty for either not participating in our study or revoking their participation. So we make this very clear in the informed consent, and then we make sure that the procedure is possible to follow. Another piece that we look for is ensuring confidentiality. So this means that we as researchers might have identifying information about participants, but we make sure that that identifying information isn't published. It's kept separate from data. We might even go a step farther and try to ensure anonymity. And this would mean that as researchers, we don't have any identifying information. So there's really no risk of a data breach or an identity kind of leak. So those are the main features that we're looking for in our psychology studies to ensure ethical treatment of our participants. This information will play a role in the proposals that you all will be writing this quarter. In particular, you'll talk about your informed consent procedure and your debriefing procedure in the methods section. So make sure you tuck this information away and you're ready to return to it when we come to that section of your research proposals. Thanks for listening.